Hello, I'm Mary Beth Marsden, and welcome to GBMC's Ask the Oncology Expert. Today, we are so pleased to have with us Dr. Fong Liu, who is a gynecologic oncologist at the Sandra and Malcolm Berman Cancer Institute at GBMC, also an assistant professor at Johns Hopkins, and she's joining us now live. Dr. Liu, thank you so much for being with us.
Oh, I'm so happy to be here.
We have so many questions involving gynecological cancers, but I just want to get real quick a sense of you and why this field resonates with you and why you find it important, and just talk a little bit about personally what it means to you.
Well, I think what I always go back to is the patients that we have in gynecologic oncology. They are the ones who inspire me every day to come in to do my job to the best of my ability. They are the most gracious human beings that put into perspective life. I could come in and see a patient of mine with ovarian cancer who's on chemotherapy, and she still looks at me with a smile and says, "Dr. Liu, how are you doing?" And I think that just puts things into perspective, and it inspires me every day to put my best effort in to help them in their journey.
I think it's so great that we're talking about this today, because I think this is one of those areas in which women will often overlook or put off some symptom they may be experiencing, especially under the shadow of COVID these days. And so let's just, acknowledge that COVID is here. It is incredibly challenging, and we're at a real peak time right now in Maryland. But there are things that still need to be addressed and watched out for, and women need to be cared for, and this is one of the areas.
Absolutely. I think, oh, go ahead, please, Mary Beth.
No, no, you.
Yeah, so I was just going to say that I think what we see at baseline outside of the pandemic is that women so often are focused on caregiving for other members of the family and have a habit of trying to minimize their own symptoms. And I think it's just so important that the symptoms that we'll talk about in terms of symptoms that may be indicative of a gynecologic cancer, that they're not ignored, that even despite these challenging times, that we have a firm, gentle, but compassionate reminder that these things are important, and without taking good care of yourself, you can't take care of the others around you.
And Dr. Liu, as you know, we've received many questions from people who are interested in what you have to say about this particular topic, and we may get some as we're in conversation, and I'll try and get to those as well. But we'll start really broadly, and if you could talk about the various types of gynecological cancers that you treat.
Yeah, so I think first and foremost, the most common type of gynecologic cancer, and this is of the female genital tract, so outside of breast cancer, is endometrial cancer. It's the most common cancer that we treat as GYN oncologists. There are about 55,000 women each year in this country who get diagnosed with endometrial cancer, and the most common symptom is abnormal bleeding. And so for most patients, this happens in the postmenopausal setting. So if you have been without a period for a year and you all of a sudden see any kind of spotting, and I always tell my patients, I don't care if it's pink, brown, bright red, anything along that spectrum, that's not normal and does require an evaluation with a pelvic exam and gynecologist.
So, and that's important that you say that too, because I think right now, a lot of doctors have been using telehealth and
Mhm.
all kinds of virtual ways of talking to patients and talking about symptoms, but you really still need to see women.
Absolutely. I think to make a diagnosis, I always talk to our trainees, our medical students, our residents, and fellows. One of my mantras is tissue is the issue. We really need to get a biopsy to make that diagnosis. And there's really a lot that we can gain from doing a physical exam of looking at the area, because it's not just the uterus that may be the cause of abnormal bleeding, but also the cervix, the vagina, and also the vulva, which is the skin outside of the vagina.
A lot of different areas in a small area, I guess,
Mhm.
but
Mhm.
they're very specific. And
Yeah.
so you treat all kinds of issues with those areas too. What are some other symptoms then, other than just bleeding?
So, another common symptom, especially with vulvar cancer or vulvar precancers, are certainly if you feel something abnormal, if during washing or something, you feel something, but itching is oftentimes a very common symptom. And so, a lot of women say, well, I was just treating myself with Monistat. I assumed it was a yeast infection. But that, again, is something that requires an exam with your gynecologist, and oftentimes, and in all times, to make a diagnosis for cancer does require a biopsy.
Brings to light, I guess, the importance of a regular gynecological visit.
Yes, yes, and certainly, if you're having any unusual symptoms, even if it's not time for your annual exam, please reach out to your gynecologist and specifically say, "I'm having these symptoms. I'm concerned," and come in to be seen.
What is the guidelines for having your annual visit? Is that still the same after postmenopause?
Yes, and so I think there are nuances in terms of how often a pap smear should be done and when they can be stopped. And there are specific clinical scenarios where each of those, you talk to your physician to know what the most appropriate thing for you may be based on your history. But there are other things, especially with regards to breast exams, and mammograms should still be done every year. So there's still absolute benefit to being seen.
How do you treat gynecological cancers? And I'm sure each case is a little bit different, I'm sure. Uh,
Yeah.
but this individual wrote they were wondering if it always involves chemo, radiation, surgery, or a combination.
So it doesn't always involve all of the three major modalities that you mentioned. So the three major modalities, just to repeat, are going to be surgery, chemotherapy, and radiation therapy. And so you're absolutely right. It really depends on the site of disease. It depends on the stage of disease. And it certainly always, in any kind of decision that we make, depends on the patient's baseline characteristics, other things like other medical problems, other important factors like being able to get to appointments, things like that. Those are all things that we talk to patients about that are important in coming together to make the best decision for the patient.
You mentioned that endometrial cancer is by far the most common gynecological cancer in the country, and I'm assuming here locally as well.
Mhm.
What are the most common risk factors for that? And you talked already about the symptoms of bleeding, but are there risk factors that we should be aware of? Family history, for example.
Yeah, that definitely family history plays a role with endometrial cancer, but that tends to be actually one of the more minor risk factors. I'll touch on it in just a second. I think when we think about the most common types of endometrial cancer, and to be clear, just for any of our viewers who are unclear about what the endometrium is, the way I describe it to my patients, and if any of my patients are here watching, I'm sure they've heard this before. But the uterus is really made up of three layers. The lining is the endometrium. The second layer is the myometrium, which is the muscle layer. And then the third layer is what we call the serosa, which is essentially the skin of the uterus that interfaces with all of the other organs inside the abdominal and pelvic cavity. And so the endometrium is the lining of the uterus. Um, and the lining responds to hormones. And so when we think about risk factors to endometrial cancer, the biggest risk factor is going to be hormonally related. And when we think about the hormones, um, that are normally circulating, it's estrogen and progesterone. And so estrogen is essentially a fertilizer for the endometrium. It causes it to grow. And then the progesterone is a hormone that essentially is like a lawnmower, if we want to continue the analogy. And so excess estrogen is what is the biggest risk factor. Um, Age is also a risk factor. And then family history, like you mentioned, so Lynch syndrome, which is a genetic hereditary syndrome that ties in endometrial cancer, colon cancer, as well as ovarian cancer, um, is also a risk factor for patients.
Does endometriosis play a role at all?
So endometriosis is less a risk factor for endometrial cancer. For our viewers, endometriosis is essentially where the endometrium is outside of the uterus, outside of where it normally anatomically should be. We think of it more as a risk factor for developing a specific kind of ovarian cancer, but not for endometrial cancer.
Would like to know, as a breast cancer survivor, do I have a greater risk of developing gynecological cancers?
So that's a very good question. At base, for all comers in terms of breast cancer patients who have been diagnosed with breast cancer, the answer to that question is no. But again, like with all of these things, it's important to talk about the characteristics of your specific breast cancer, and to also understand your family history. Because if there is a significant family history of breast cancer, of ovarian cancer, then certainly that may, that would warrant an evaluation by cancer genetics to see if you carry the BRCA gene or a related BRCA-like gene that puts you at increased risk for developing other gynecologic cancers.
You know, I feel like we've gotten some indicators as to who might be more susceptible to breast cancers, but do we have any indicators as to who might be more susceptible to gynecological cancers?
So I think going back to one of the other questions about risk factors for endometrial cancer, just to we do know that obesity is certainly a risk for endometrial cancer, and specifically that actually has to do with the hormone imbalance that I was talking about before. We know that there are enzymes in our fat cells that convert other hormones into estrogen, and that's what that pathway. That's how we explain how that is a risk factor, because then you have increasing circulating estrogens in the body, what puts you at risk for endometrial cancer.
Another question, why do breast cancer patients stay on aromatase inhibitors? I pronounced that correctly, right? Aromatase inhibitors. For 5 years, typically, while ovarian cancer patients are prescribed them for the rest of their lives.
So that's also a really good question, but I think it it's a blanket statement about both breast and ovarian cancer that requires us looking at it in a more nuanced way. So the viewer is absolutely correct that oftentimes patients who've been diagnosed with breast cancer do continue on an aromatase inhibitor either for prevention of recurrence for 5 years. But there are other times where it may be used as treatment. Certainly, anyone who's been diagnosed with breast cancer should discuss that with their oncologist. In terms of ovarian cancer, when we use aromatase inhibitors is really when we've done special studies on the tumor, and if they have a hormone receptor on the tumor, then it's most often used as a treatment modality that's generally well tolerated. And so with any treatment that is time limited, sometimes if it continues working, it is continued indefinitely. But again, the nuances of that really have to be explored within the context of each patient's diagnosis.
And an aromatase inhibitor is lowering your hormones, if not
Yeah.
completely depleting them.
So an aromatase, so what I mentioned earlier about the enzyme in our fat cells, that's the aromatase actually. And so when we inhibit that enzyme, it actually reduces the circulating levels of estrogen in the body.
What screening or testing, if any, is necessary after a total hysterectomy for uterine cancer?
So for patients with uterine cancer, again, it depends a little bit on the stage that determines the exact schedule for surveillance. But for most patients, we do pelvic exams at regular intervals every 3 to 6 months. Again, it depends on the stage. And the pelvic exam really helps us evaluate the top of the vagina, which is the most common place where endometrial cancer can come back. So that's really the main follow-up that's required for patients diagnosed with endometrial cancer.
Has the use of the HPV vaccine in young people made a difference in diagnosed gynecologic cancers, and what has the impact that you've seen?
So HPV vaccination, every chance I get, I strongly encourage patients to get it. It's now FDA approved for men and women up to age 45. And it has been shown to decrease infection with the most common HPV strains that cause cervical cancer. It also, because of the strains included in the HPV vaccine, also has reduced incidence of anogenital warts. Um, and also because of the role of HPV in the development of anal cancers as well as oral pharyngeal cancers, the data isn't as robust yet for those cancers, but also reduces the risk of that as well. So it's something that I highly encourage patients to get.
So it's been around long enough now that you're actually seeing real data.
Yeah, yeah, absolutely. It's every patient who I meet, who I see for diagnosis of cervical precancers, cervical cancer, every opportunity I get to educate and empower women to get it for their children. And if it's a cervical precancer, um, uh, there's been important work done by my partner here at GBMC, Dr. Levinson, that vaccination can actually help prevent precancers from coming back. So it's really important.
Can ovarian cancer be detected with blood work?
So at this point, we cannot detect ovarian cancer with blood work. There's still, unfortunately, not a good screening method for ovarian cancer at this point, but ongoing research is underway to hopefully develop something in the near future to help us with ovarian cancer screening.
So, as a woman and, learning about cancers, in our 20s, what have you, ovarian was always the big scary one.
Mm-hmm.
And I feel like we still haven't come very far when it comes to figuring it out earlier.
Yeah, so I think to address that particular point, I think all gynecologic oncologists, all caregivers for women wish we have made more progress in terms of screening. But I will say that in the last, 5 to 10 years, in terms of treatments for ovarian cancer, really pointing to having just very tailored treatments for patients. We've really made some great progress. This is kind of going back to the family history piece. In the last few years, there have been an entire class of medications that have been approved for treatment for ovarian cancer that is very promising, that the entire gynecologic oncology community is very excited about. So it's important to know your family history. I just want to stress that. And to not be fearful of discussing it with both your family and your doctors. Because I think a lot of times with these cancer diagnoses and historically, culturally, for a lot of families, it's just not something we talk about. It has to do with organs that, are private. But no, this is about your health. This is about, you know, taking good care.
Are are you seeing more women who are finding out about their family history making decisions, or are decisions available to them, such as a hysterectomy, as a preventative measure?
So, absolutely, there are risk-reducing surgeries that are available for women diagnosed with BRCA mutations and other BRCA-like gene mutations. Um, and again, it's something that if you find that you have multiple members of the family, or if there are members of the family who are diagnosed with cancers at a young age, that is definitely a reason to discuss this with your physician and to seek out cancer genetic testing. And we are seeing more patients come with that information, and it's a great thing to see.
How would someone treat excess estrogen in order to lower the risk for endometrial cancer?
So that's a great question. It is, I think it's important to think about the risk factors that we talked about. And so a healthy diet and a healthy weight is definitely very important. And again, a conversation that I have with my patients as well is a healthy diet and a healthy weight is also combating the number one killer of women in this country, and that's heart disease. And so I think that's important to acknowledge. Outside of that, I think it's important to also talk to your family, talk to your parents, understand your family history, and if there is a family history and if it's appropriate to get genetic testing.
Cancer obviously can affect so many areas of a woman's life, or anyone's life, really. What do you recommend for family and friends to support those going through this journey or who are on this journey?
I think a common thing that I've experienced with my patients, or that my patients have experienced, is that most friends and family are wanting to help. And it's oftentimes a time where people come together. But oftentimes I have the conversation with my patients to say, yes, they may want to help, but let's think about what is going to be the most helpful for you. And sometimes that may be, especially after a big surgery, people, outside of the COVID times, when people could visit, I have lots of visitors, I have people wanting to check in, and honestly, I'm just exhausted. And then I tell them, be honest with them. These are your friends and family who are there to support you. And if now is not the right time, then tell them. And I think to the friends and family of patients who have been diagnosed with cancer, respect that they may want to receive help in a way that may be a different definition than your own, I guess.
The family, if your friends or your family are affected by cancer, let's just talk about the broader community and how they can support the Berman Cancer Institute at GBMC.
Well, the Cancer Institute at GBMC there's a excellent oncology support services group at the Cancer Center that does so much to allow for patients to get the care that they need. Um, Oncology support services will provide support to patients. Most of the support that patients need often comes in the form of transportation to get to and from treatments. And so they offer that, and that's a great way to support the Cancer Center. They also provide counseling and means to get to other therapies, counseling therapies, group therapies, to help patients and their families navigate this journey. Both, well, not both, but from the time of diagnosis through treatment, surgery, chemotherapy, radiation, and also survivorship. Oftentimes, the time where you actually have time to process what's happened to you with a diagnosis and all the treatment that comes with is after you finished it. And so that's also a really important time where the Cancer Institute provides support. So that would be really any support that's given to GBMC at the Cancer Institute in oncology support is just, it's so needed, and the patients are just so grateful.
Yeah, and I know a great place to start for any of that information is on the website. It can lead you to all sorts of places where you can help. I'm just going to ask you real quick to put on your professor hat. I'm just
Yeah.
curious because you're working with now young people who are interested in the field of medicine. Is this particular area still one that is vibrant and you're finding people are still gravitating toward?
Yes, absolutely. I think as we as a society are really incorporating all aspects of life into medical care and recognizing how important acknowledging those aspects of life are in the receipt of care. Cancer is something that touches every aspect of a patient's life, as we could all imagine. And so it provides that extra challenge and stimulation and really fulfillment. I think, of course, I'm biased that other areas of medicine may not do as much, but the interest is alive and well for sure.
I'm glad you're biased, for one.
Yeah.
And I'm sure your passion comes through to your students, too. So thank you. And thank you so much, Dr. Liu, for joining us today and
Oh,
talking about gynecological cancers and care for women who are watching. We appreciate you being with us on Ask the Oncology Expert.
thank you.